Hi, I'm Laura Long, and today I will be presenting on a few issues in transgender healthcare and the steps we can take to prevent them. To start this presentation on transgender healthcare and the disparities that arise with it, I wanted to first explain what it means to be transgender. According to Trans Student Educational Resources, terms are continuously changing in the LGBTQ+ community, but the most updated definition is an encompassing term of many gender identities of those who do not identify or exclusively identify with their sex assigned at birth. The term transgender is not indicative of gender expression, sexual orientation, hormonal makeup, physical anatomy, or how one is perceived in daily life. So, why is transgender healthcare an issue? The transgender population faces much stigma and discrimination, not only in everyday life, but also in healthcare. There are significant barriers to care for the trans population, very much due to discrimination, prohibitive cost, and difficulty finding transgender-inclusive providers. Transgender identities are also not typically recognized in public health research, so the funding for this population is very limited. From the Colorado Transgender Health Survey, 40% of respondents reported delaying medical care due to cost, inadequate insurance, and/or fear of discrimination. A 2011 study found that 19% of transgender patients were denied access to treatment due to their identity. What are some specific disparities in terms of health conditions? First, I'll discuss mental health within trans populations. A study by Seelman showed that those that reported a non-inclusive primary care provider or who delayed medical care on the basis of fear of discrimination were less likely to have a routine checkup and more likely to have current depression or suicidal thoughts in the past year. In fact, 41% of transgender individuals have reported at least one suicide attempt in their lifetime. These are important stats to note because mental health is a crucial determinant of overall health. However, if trans individuals are fearful to seek out care, the mental health needs of this population are substantial and not being met. Are there any differences between cis and trans populations for chronic conditions? Yes. Transgender individuals are more likely to have multiple chronic conditions than cis individuals. Why might this be the case? As I mentioned earlier, many decide not to reach out to their providers or go to their appointments for fear of discrimination and unequal care. With many individuals receiving inadequate and infrequent care, chronic conditions are more likely to get out of control. So you've heard a little, and really we've just grazed the surface, about disparities in care that the trans population faces in the health setting. Now, what can we do about it? I read a wonderful and informative article about how providers can become educated on transgender care. The first main point was that all transgender patients are unique and all need different things from healthcare, including care that is centered around their transition status. Providers need to make sure not to generalize or group trans individuals into a specific timeline of what should happen in regards to their transition. There is no single right way to transition, and there is no order that events such as hormone therapy or surgery need to happen in. A second lesson to providers is that patients should not have to conform to a provider's ideals of what men or women have in regards to anatomy. For example, some trans men choose not to undergo surgery for a penis and may face discrimination from providers that cannot understand this. One specific example of this was a provider feeling like a transgender man had doubts about his transition on the basis of not desiring a genital change. This was offensive to the man because the provider was discrediting his identity purely based off of his anatomy. Instead, providers should understand that this physical change does not have to be the cornerstone of a transition, and that genitalia does not define gender. Due to time, I will only be talking about one more subject in caring for trans patients. This is asking patients which information to document in their health records to preserve confidentiality. This is important to make sure that providers do not directly out trans patients to everyone. Some patients do not wish to share their transgender status with many health professionals due to fears of discrimination. Showing sensitivity and asking patients what should and should not be included in their documentation is a practice that will increase trust and preserve confidentiality. So, what is the takeaway from this presentation? Education and training are key to improving the disparities and discrimination transgender patients receive on a daily basis. Education is also important for increasing provider comfort and awareness, two things that will improve the quality of care transgender patients receive in the healthcare setting. Hopefully, we will soon see a system where providers are inclusive and responsive to different patient backgrounds, including trans care. Cultivating safe and respectful environments for patients will hopefully deepen the overall trust of this population and lead to more regular primary care, which could improve other disease disparities that stem from this. I hope you enjoyed this presentation and learned a little bit more about the topic. Now I have 2 discussion questions. 1. Do you agree with the point that providers should ask patients before including their transgender status in their medical records, or is this something that most likely concerns all medical professionals, so it should be included regardless? Support your opinion. 2. Along with proper training and education of both students and established providers, how can we ensure that the transgender population feels comfortable and able to approach a medical provider with any issue? Thanks.